be muted. However, you can unmute yourself throughout the presentation if you'd like, but we'd like to hold questions toward the end to ensure that we've got ample time to respond to those. Feel free to drop your questions into the chat throughout the presentation if you like. Again, that feature is in the bottom right-hand corner of your screen, and you may see some of the presenters responding to you directly in the chat. For those questions that we don't get an opportunity to answer, we will follow up with any unanswered questions by sending out the question and appropriate responses via email to the group. So MiHIN is Michigan's initiative to continuously improve healthcare quality, efficiency, and patient safety by promoting secure electronic exchange of health information. We represent a growing network of public and private organizations working to overcome data sharing barriers, reduce costs, and ultimately advance the health of Michigan's population. Sounds like we've got someone off of mute. If you can please make sure that your line is muted, I'd appreciate it. Thank you. So we have 5 key focus areas here at MiHIN: convening people to figure out functional solutions. We champion statewide use cases to get data flowing and keep it moving securely among all legitimate parties. We operate as a shared services with things like our health directory, active care relationships, security, legal, client matching, etc., as behind the scenes infrastructure. We provide tools to support daily workflows and coordination. And we also do reporting, conformance, and analytics from data lakes and the longitudinal health record. For today's agenda, we are going to give a recap of Series 2, or Session 2 rather, of our imaging workshop series that'll be presented by Jason Vismara. We'll follow that up with an overview of the Connecting Michigan for Health and More series and cover some closing announcements. And for any of those of you who joined in just a few minutes late, we did have an audience poll to kick things off, which you can drop your responses into the chat, but we're just wondering how your organization utilizes ambulatory ADT notifications. So with that, I'm going to go ahead and introduce to the floor Jason Vismara, Product Marketing Manager, who's going to give us a recap of the Imaging Workshop Series, Session number 2. Jason?
Thank you, Tracy. Good morning, everyone. So Tracy mentioned this past week, we actually just held our 2nd session in the Imaging Workshop Series. We're really trying to continue going through the imaging workflows and how we can best support the needs of the community in Michigan. And the next slide. So the purpose of the workshop is really, like I was saying, to help frame out that enhanced data sharing opportunity for the use case that we can use to exchange the medical images, trying to identify where the key barriers are today, how we can address them, prioritizing those different data sharing scenarios, and then ultimately creating a white paper that we'll use to really help to drive that use case and any new enhancements that would have to be built around that to help best support that data sharing opportunity. And I think I'm getting a little bit of feedback. If you're off mute, please mute yourself if you're not talking. We can go to the next slide. So the audience that we had at the past session was predominantly on the hospital systems. We did have a couple of HIEs that were kind of built into the combination organizations, those that were representing a few different areas. But definitely, we want to continue to expand that and making sure we have the various HIEs at the table, as well as the physician organizations and health plans at the next workshop. Continuing to see what we can do to hit all those areas and ensure the feedback from everyone is included in that white paper as we continue to drive forward with the workshop series. So a couple of the highlights and key takeaways was, so we started off going over the recap of the first session where it was largely focused on those health systems and the organizations that are providing images and some of the technology options that are available. So trying to look at, the current state of the imaging exchange, how it's being moved throughout the state, and, where some of those key barriers are. During that session, one of the key areas that was identified that we might be able to continue to dive into was a statewide index for the imaging facilities and the images available for a patient. So we went through the current state, looking at the current workflow for the providers, how they're going into the various workflows and accessing images, what it takes for them to download the images, and then really going a lot deeper into that index and the types of information that could be useful, understanding what could be shared with an index and making that so that it's kind of that one-stop shop where you can go to the Health Information Network at MiHIN and being able to identify where to go find an image, what support's available, kind of understanding what we can use with our existing infrastructure to support that workflow that right now is extremely burdensome for a lot of the facilities throughout the state. And then we took everything back from our breakout sessions to discuss the current state and statewide index and really trying to understand what those key takeaways were from the various groups and any of the recaps, which we'll go over here in the next couple slides. So one of the first topics was around the current state. What we were taking away from that is really, there's a lot of vendors that are not always able to easily exchange images with each other. Some of the organizations can only send images with one of the vendors and they have to receive them through another, or it depends on which facility they're going to. And it really puts a lot of burden on those staff members that are trying to go and fetch the images for their providers and the patients that are coming into their offices. The DICOM standard also has a lot of challenges associated with it, depending on the organization and the user that's inputting the data, running the study. The metadata elements within it can vary. There's no JPEG image or anything to kind of see just an initial look at that image without downloading the entire very large file, and some of those other challenges that we continue to go through during that workshop. The other thing that was identified is that there's currently no legislation requiring organizations to share images or information like the header information to a central repository like we found with some of the other use cases and services throughout the state, where it's identified that this could really be a valuable area that we could continue to explore and see how we can support some legislation to potentially allow that. Obviously needing to dive into some of those repercussions and the what burden that could add to just share the information, but seeing how we can best maybe support that and identifying a solution that can really help both sides of the workflow for providing the images, but being able to access the images as well and knowing what's available for the patient. I think someone slipped off mute, so if we could mute your lines.
Good.
I think we can go to the next slide. And then the other key topic that we went through was the statewide imaging index. So some of those key takeaways that if everyone could mute your lines, would be much appreciated. So some of those key takeaways was the central directory for images available, some of the services and contact information. So being able to understand if there's a 24/7 service line available, how you can contact them. To understand how you can pull back the image if there's any nuances you have to work through, is identified as something that could potentially be an easier kind of first step, trying to leverage the existing infrastructure and being able to know where you can go for those images. And then really trying to get more into that central registry too of the images available for a patient, where if organizations were sharing key information like the headers in the DICOM messages, being able to leverage that to know just kind of what image is available, some high level information about that without having to store everything in one place, but kind of getting you to like a hybrid statewide packs to know where those images are. And trying to leverage the statewide infrastructure around patient matching and, addressing that burden right now of, knowing who we're talking about, and ensuring that we're all looking at the same patient and the images are actually for the same patient in those disparate health systems. And then with that, avoiding having to synchronize all the image updates. So when today an image is exchanged over to another system, avoiding that issue, if the patient was merged or unmerged, and any of those updates that may happen, they can all live in that source system, and being able to just go fetch that image in real time and assisting the workflow that way we don't have to synchronize all those updates throughout the state. Some other things we talked about was the potential to enhance the continuity of care documents with the reference information for an image and really the radiology sections. Seeing what we can do to kind of bring all that together in one spot for the report and the location of that image. Next slide. Right. So if you haven't been able to join yet, it's still not too late to join some of the upcoming workshops. Our next one is planned for April 1st from 2:30 to 4 o'clock, really trying to hone in on some of the benefits around the health plans. And then, really narrowing down those technical interoperability approaches that we've been starting to discuss. So we'll be consolidating the various notes from the last workshop and really trying to use that as a basis for figuring out how we can best prioritize this to, understand where some of the gaps may be, what can be shared today, what may need a little bit of work at the various systems, and how we can best address those different aspects of the workflow. After that, on April 29th, we'll be reviewing the initial white paper outline, which is kind of that draft of, the burdens, the current barriers that are in place, and how we're going to plan to address that, some of the prioritization around those data sharing scenarios. We'll be going through the outline and starting to draft the white paper, getting all the content down on April 29th. And then our team will be working to kind of clean up everything that comes out of that April 29th session, and on the 5th session on May 25th. We'll be doing a final white paper review with the group to try to finalize that and see what we can do to ensure that everyone's on the same page and agreeing to what we're writing down as part of that white paper. And if there's any questions, feel free to reach out to myself, Jason Bismara. My email's there on the screen, or else Tracy Webb can always get you in touch with me as well if you don't get a chance to write this down. Or you can always go through our help desk as well with help@mihin.org if there's any questions, and those will get routed to myself as well. So if there are no questions, you definitely feel free to post them in the chat, or like I said, reach out to me after, and we can definitely work on addressing those.
Thank you, Jason. Brian, can I get a quick check-in from you on any questions that might have come up throughout the presentation for Jason? I think he's going to have to leave just before 11:30, so I want to make sure that if there are any questions, we get those answered before then.
Sure. Haven't seen anything just yet, Tracy, but I'll keep an eye out and give you a heads up.
Okay, great. Thank you, Brian. And if there are any questions that anyone thinks of along the way, you can always submit those to me and I can follow up with Jason after the presentation. Okay, thanks again, Jason. So next up, we have Katie, who's going to give us a overview of the Connecting Michigan for Health and More virtual conference series. Katie?
Thanks, Tracy. Hi, everyone, and good almost afternoon. I'm sure everyone is starting to think about what they want for lunch. I know I am, so I appreciate you taking your time to hop on this call and to listen to some of the information we have to share. So my name is Katie Kalashewski. I am the events manager here at MiHIN. And as a part of my role here, I help lead the team that executes the Connecting Michigan for Health and More virtual conference series this year. So those of you who have been longtime MiHIN supporters are probably familiar with our Connecting Michigan for Health event. We are kind of changing things up a little this year, moving it virtual and turning it into a year-long series rather than a 2 to 3 day event back to back. So Tracy, if you want to keep going through the slides, we can delve into it a little bit more. So our theme for this year is Healthcare Technology 3.0. So as we all know, 2020 has kind of been the perfect storm. And so a lot of the issues and topics that have been top of mind, for the last couple of years are still going to be, pertinent in 2021. But now, we really need to view them in the context of everything that has transpired last year. So we're kind of coining this the healthcare 3.0. And so we are going to talk about its implications for the ongoing evolution of healthcare delivery, experience, costs, and outcomes. So we're going to, bring together leaders in healthcare, legal policy, interoperability, and, many other fields to really engage in these discussions and to network with peers, in similar industries. So if you want to keep going, Tracy, I think we'll get into the dates, which obviously are important to know. So again, as I mentioned, we have shifted from a 2 to 3 day conference back to back to spreading it out over the entirety of 2021. So we're going to have 2 full day conferences featuring, our keynote speakers, which will bookend 3 half-day workshops. So some of our topics are, social determinants of health, the ONC CMS final rules, e-consent, virtual care, a lot of really great topics covered by really great subject matter experts. So things are going to kick off here in less than a month on March 23rd with that first full day conference. So that'll be the intro to this series. Then April, June, and October will be those 3 deep dive workshops. And then November, we're going to really round things out and talk about what has transpired throughout the year. The changes that have happened, what we've seen from that first March event, until that November date. So those are kind of just the dates. You should have received, emails from us with those dates and links to register. If you haven't, please let us know and we'll make sure to get those to you, but registration is open if you'd like to join. And actually, I think I might be skipping ahead, Tracy, if you want to go to the next slide. So for our March 23rd conference, we have 2 great opening and closing keynote speakers, which you'll see on the screen. And then we'll have panel presentations and discussions on social determinants of health, policy and bioethics, and e-consent. And then we're going to do spotlights on our Referrals Plus, Interoperability Land, and our Care Convene Telehealth. So that's just the March conference. Again, the November one will be very similar. It'll just kind of talk about what has transpired throughout the year on these topics, and we'll have some different keynote speakers. Next slide, please. And then, like I mentioned, you should have already received this in an email, but if you haven't, please absolutely let us know, and we'd be more than happy to get this information over to you. You can register on our website, or like I said, just email one of us and we'll get you the link to do so. If you have any questions, our email address is pretty simple, connectingmichigan@mihin.org. And then just wanted to give a shout out to our sponsors who have, really helped make our event the success that it is. And there still are additional sponsorship opportunities. If your company has any interest in being a sponsor or exhibitor, we'd be happy to have you. If you have any questions, please don't hesitate to let me know, either in the chat here, or like I said, Tracy can share my personal email, or you can reach me at the connectingmichigan@mihin.org. We really hope to see everyone there.
Thank you, Katie. Are those events, I assume those events are all listed on our events page on the website as well, in case people don't for some reason get the notifications via email?
Yep, absolutely. So just mihin.org/events. We have a whole website with all of our different events, and Connecting Michigan is right at the top. And then that'll take you to the website that has all of the Connecting Michigan information. So our working agendas, our speakers, the timing, the registration link, the sponsorship opportunities, all of that great stuff.
Awesome. Well, thank you so much for that information, Katie. We're looking forward to seeing everyone there. Brian, I want to give a quick check-in with you to see how questions are coming along in the chat, if we've got any, or if we have any responses to our open question.
Thanks, Tracy. Lots of good responses to our to the opening question. No additional questions about the ambulatory ADT notifications or about Connecting Michigan for Health and More just yet. Although, folks, I encourage you to submit those. Getting back to the survey questions about ambulatory ADT notifications without specifically without specifically identifying individual contributors, I can say that the comments run the gamut. So there's a couple that have said that they are not currently using ambulatory ADT notifications. Some who have said that they are not currently, but are planning to implement in the near future. Here's one that says, yes, we use them. We find them helpful to find more up-to-date information than is in claims. Some are using them in pilots with a couple of high-risk patient cohorts and to notify care managers. Initial work is beginning on direct HL7 interfaces into the EMR as well. Many practices are receiving ADT notifications through a feed from Wellcentive. And then just as a sampling again, our people receive them about 90% of the time. They don't necessarily have a clear distinguishing element to show that it is either an ambulatory alert or a facility outpatient alert. So several other comments of feedback there, but that's a sampling of some of the ones that were posted.
Well, thank you everyone for those responses. We're always curious, you know, what you find of most value, and I like hearing those responses because it helps keep fresh in my mind how all of those things are used at the point of care. As we all know, I'm sure ADT notifications are really the pillar of assisting with care coordination, and that care coordination becomes easier when you know who is all involved in a patient's care. So if anyone has any questions about ADT notifications, feel free to reach out. You can always reach us at help@mihin.org if you have questions or want to get started with any kind of ADT notification service. We're here to help. I'll end with a couple of announcements and then give one last check-in to see if we've had any questions. Remember to check out our monthly newsletter, the interface at mihin.org/the-interface. Next edition of the download will occur on April 6th at 11 a.m. In addition to that, want to welcome anyone who is interested in attending session 3 of the imaging workshop. The focus of that will be health plan benefits and technical interoperability approaches. We'd really like to see a wide variety of attendees in workshops so that all angles can be considered and heard. So if you'd like more information about that, please feel free to reach out to me at tracy.webb@mihin.org. And then again, our Connecting Michigan for Health and More series kicks off March 23rd, kind of a long registration URL there, but you can always find those registration links under our events page on the MiHIN website. So before we set everyone off to lunch, Brian, any more questions that may have trickled in toward the end there?
Not so far. We are all covered.
Okay, sounds great. Well, thank you again, everyone, for joining us. Thank you for participating in our poll. We look forward to seeing you on April 6th again. If you have any ideas for topics, please feel free to send them to me, and have a great day.